Hello everyone, in this video we will be seeing about high voltage pulse galvanic stimulation. Definition: it is a twin peak monophasic wave with a fixed duration in microsecond range up to 200 microsecond and a voltage greater than 100 volts. Waveform characteristics: HVPC stimulator has a twin peak monophasic waveform with a fixed duration up to 200 microsecond, fixed value, voltage is up to 500 volt. Voltage above 300 volt may cause skin breakdown resulting in burn. The twin pulses with peak voltage of less than 300 volt each are selected rather than a single pulse of 500 volt. Frequency independently controlled from 2 to 100 Hz. Wave shape: the pulse is a monopolar twin peak with an instantaneous rate of rise and a slope on the downside of each peak. The twin pulse waveform has almost instant rise with exponential fall. Two forms of high voltage pulse galvanic current: short duration twin pulse with a small interpulse interval. The pulses have instantaneous rise time and intensity, drops to half of maximum in about 7 microsecond. Pulse separation is 65 microseconds. Second uses the same 7 microsecond pulses, but the time between the start of each pulse is reduced, so twin spike overlap. The overlapping twin spikes reinforce and the effective pulse duration is about 14 microseconds. This results in a stronger motor response with overlapping waveform. High voltage pulse galvanic current device includes wave shape and pulse duration. It is fixed and cannot be changed. On-off time control. Off means current is not passing. Polarity switch. It sets the polarity of the active pad in relation to the dispersive electrode. Active pad delivers the treatment frequency and dispersive electrode completes the circuit. Electrodes used: active electrode, either a pad or handle probe electrode. Number of active pads varies from 1 to 4. Active pad may be positive polarity or negative polarity. It is placed over wound or treatment area. Dispersive electrode. It is used to complete a circuit. It is placed proximally to the treatment area. Amplitude control. It sets up to 500 volt. Pad balance. This permits independent amplitude control over two active electrodes. Pad or probe mode switch. This switch regulates pattern of stimulation that is continuous, surged or reciprocate. Surge train. It controls on-off cycle. Output meter. It permits units of measurement in voltage and current. Microspace switch. It is a manual regulation of interpulse interval. Indicator light. Uses: wound healing, pain modulation, muscle stimulation, reduction of edema, reduction of muscle spasm. Method of application: documentation, procedure, treatment parameters, assessment. Indications: muscle sprain and strain, post-operative to reduce pain, to reduce edema, to improve muscle function. Cervical and lumbar pain, temporomandibular joint dysfunction, pain associated with debridement, phantom limb pain. Contraindications: circulatory impairments, over carotid sinus, patient with pacemaker, pregnant woman, seizures.